your knee surgery in 1 week. And
Yes.
what was the thing that made you want to finally get it done?
Well, Cheryl, I didn't have any choice. I went to step down and I couldn't walk. My artificial joint is so loose, it was actually dislocating. And I just wasn't stable. I couldn't put it off any longer.
What are all the complications that you have that other people that are just going in to get like just one first knee replacement, you know, they've got one knee to replace, but you have all these other things on your body going on? Like, name all the things that you have that they have to deal with and keep stable. You've got you've got a Coke pouch, which we'll probably do a separate video on.
Okay.
You've got
how long does the battery last in your camera? I think this might be too long. Why don't we go on what I'm dealing with as far as this surgery goes? One thing that concerns me is I do have a pinched disc that's causing my upper extremities to not get the proper blood supply and air, and I've lost a lot of muscle in my biceps, and I was going to actually have that surgery done first to correct that, because I've lost, use of my hands. It's very hard for me to open and close them. They're very weak. And being how I know I'm going to have to be on crutches for a couple weeks, I really wanted to get the hands done first. But because of what happened with my knee, I have no choice, and I have to have that done first. If it was some normal person just having a second knee replacement, which a knee replacement lasts anywhere from 10 to 15 years, and I am on the 15th year. And that's if somebody follows the rules you're supposed to with the knee replacement. I didn't. I tried to jog on it, I ran, I did a lot of activities you're not supposed to do. So for mine to last 15 years in the first place, it was a miracle.
Did you run on it? Did it hurt?
I jogged on it. I'm still able to jog with my prosthetic leg. But the constant pounding on an artificial joint, you're not supposed to do.
Yeah.
And I did it anyway. So most of the time it was actually on a treadmill. It wasn't out, jogging out on the street or the pavement or something of that nature. But my biggest problem is I've had a partially torn quadricep for the last 5 years. And because of that, also my kneecap has dropped lower, about 1.5 inches below where it's supposed to be. And I just found out when I went in to have this evaluated and they did a sonogram that my kneecap's actually cracked in half. So a normal procedure for a total knee replacement for somebody that's already had one, just replacing the components, is about 45 minutes. They said mine's going to be about 2.5 hours, because the big problem is repairing that quadricep. I've always had very, very, very strong quadriceps. So since it's been separated for so long, it's going to be really hard to graft it together, and also to reposition my kneecap. He's not even sure he can do that, which I don't know what that means.
Yeah, he talked about how he may not be able to bring the kneecap up, but at least he could move it over.
Right. Because right now the problem is, since my joint is completely worn out, my foot is rotated all the way to the right. So when I go to step down, I'm totally off balance anyway, and it doesn't allow my knee to bend correctly anyway. So I've had to compensate for that, because I've been putting this off as long as I can, and I'm to the point that I just can't. The major risk of my surgery versus somebody else is I was born without the MR2 gene, which prevents your blood from clotting. And I am on a blood thinner because I've had 2 pulmonary embolisms in the past during surgery. The last one almost killed me had I not had a valve in here. I had blood that backed up from my chest all the way into my legs, and I was actually in the hospital for 6 months. So
what is this? When did you have this valve put in?
years ago. I went in for minor shoulder surgery, and I had my first pulmonary embolism. And after that, they inserted a valve in me. So I've had the valve for years.
Where's the valve sitting?
The valve sits right down here in your big blood vessel. Because normally a pulmonary embolism starts in your legs. You know, that's why they tell a lot of people, if you're on like a long, if you're flying to Europe or something, to get up and walk around, because anybody can get an embolism, and it starts in your legs and then it moves upward. And if you don't have a valve, you know, it can go to your heart or your lungs and kill you. So fortunately...
So you're really going to need to be careful on wearing the compression stockings they normally give after, you know, the surgery.
I'm going to have to be careful, period.
Yeah.
I have to stop my blood thinner on Friday and then bridge myself with Lovenox, which is an injection that I give myself every 12 hours. I have to give myself 2 a day, and then give myself 1 Sunday morning and stop until after surgery. And the reason they switch you from, I'm on Risolto, the reason they switch you to Lovenox, it's a shorter acting medication, so it'll have worn off by the time of surgery. I have to be at the hospital at 11 o'clock on Monday, but surgery is actually scheduled for 1.
So, why are you wanting to videotape everything and have this all documented?
Well, for people that don't know, I'm the president of FightOpioids.us, and I'm in the process of launching a class action suit against the opioid manufacturers and distributors. And I work with a foundation, as you know, because you're a part of it, to send people to long-term rehab for opioid and alcohol addiction. So I'm trying to set an example and show people you can go through a major operation without taking any form of opiates. Because it's my goal to try to do this with nerve blocks, Tylenol, and no form of opiates. And actually, I want to reiterate that. I'm going to do it regardless what the outcome is.
You're not going to try, you're going to do it.
I'm going to do it.
Right.
From hell or high water, you will not see an opioid go in my body. And since you're going to be documenting this whole thing, you'll be right there and you'll know.
I mean, I keep bringing this up, but it was really important when you went to the doctor appointment, the guy who's doing the surgery, and he just freely, no big deal, you know, shared that outside the United States, he does these surgeries all the time and people walk away with knee replacements. Obviously yours is more complex, more reconstruction. Walk away from a knee replacement with just Tylenol, no opiates.
I think you and I both got an education because you were there.
Yeah.
And he said that 80% of all opioids or narcotics during surgery is taken in the United States. Most of the countries don't allow opioids during an operation.
Yeah. So
we're the culprits here in the United States that have fueled this drug problem.
So so this video might not go out until the day of the surgery, but you're going to be going live some and then recorded, and if they allow it, record the surgery itself, which for anyone watching this video, you're probably seeing this on YouTube. The recorded video, if we're allowed to broadcast the actual knee replacement, will only be on Amazon and you will need to pay for it. So that's something that we're still waiting for authorization for.
But, you know, yes, we are going to document after the surgery, after I wake up from the recovery room, because I don't know what kind of condition I'll be in, will document the medications that the doctors are actually giving me and the nerve blocks they're using, because it'll be educational for people that know they're getting ready to have surgery, to know that there is a way to do it without somehow coming dependent on opiates or narcotics.
Yeah. Which
nowadays, with the strength and the addictive power, it's so easy to happen. I mean, I preach all the time that opioid addiction has no social boundaries. It doesn't matter who you are. Stuff's very potent, and some people can take it for months and not get addicted. Other people can take it once and bam. So, you know, I'm hoping, and I'm doing this just to set an example that there are other alternatives other than taking narcotics or opiates. That's my goal. That's my goal here, besides to be able to walk again correctly.
How long have you been either limping or having your knee hurt? That
5 years before you even go any further.
5 years.
It's been bothering me for 5 years. Over the last year, when the joint wore out so bad, it caused my foot to rotate out to the right because it doesn't hold it in place any longer. But within the last month, it got to the point that every time I stepped down, you know, it was very painful, and I didn't feel stable. You know, I'm a big man. I'm 6'5". My license says 6'6", but I think I'm shrinking, and, you know, I'm 250 pounds. And, you know, it's a lot of, you know, there's not any stability there anymore.
Yeah, I think it's been hurting so long. I mean, it's probably done, you probably don't realize, I don't know. You probably don't remember what it's like to be able to walk without pain. I mean,
I don't know. I don't remember what it's like to be able to walk normal. I could walk extremely normal with my prosthetic leg before my joint in my right leg got out of whack. You know, I could step down. Most people couldn't even tell. I didn't have a limp. You know, I wear shorts a lot, so obviously people know that I have a prosthetic leg, but if I have on long pants, you can't tell, because, you know, I walk normal. But also, it's caused my whole structure to be off. It's, you know, I'm bent over, and I'm doing everything to compensate being able to walk, and it's really, you know, it's really caused my posture to really become really bad, which I need to work on after I get my knee straight.
Well, I have no doubts that you're going to be walking completely normal, feeling amazing, wishing you would have done this like 2 years ago. But anyway, well, I guess, all right, so we'll just end the video here.
Okay, here I am prior to knee surgery. It is now 8:30. They won't let Cheryl film in the operating room or in the recovery room. We're gonna film as much of this as we possibly can. I'm in great spirits. I'm looking forward to walking normal again, being able to work out a little harder. So anyway, this is the first segment of this whole journey. We will film me when I get out of the recovery room, and Cheryl will document all the medications I take over the next week, and hopefully this will be helpful to a lot of people. See you soon.
How you feeling?
How am I feeling? Feel great.
You're so full of shit.
Huh?
No, is any part of your body hurt right now? You've got a nerve block still left in you. And you're going to get Tylenol and Tramadol.
Okay. But I did this with no opiates.
Yeah.
I'm happy about that.
Yeah.
And the surgery went well?
Yeah, it went good. They literally lifted your entire what did they call it? I forgot what they called it. They took your entire knee off. They had to get in and scrape everything out. They had to reconstruct it. They had to reconstruct your quadricep, tighten it up, flip it over. He said he put more sutures in that than he's ever put in anything. And
he said that he put more sutures?
Yeah, he's like tons of sutures, and no bending your knee for 30 days.
Wow.
But you've only been out for about an hour, and they're going to get you up in about 2 hours to walk.
Oh, I get to walk too?
Yeah, they're going to get you up to walk in 2 hours.
Huh.
So,
Well,
So what do you have to say to all the people that like whine and cry that they can't go through a surgery without? I'm just kidding. I'm just kidding because a lot of pain hasn't come yet.
I feel really good. I'm really proud I was able to do this so far. Let's open the skirt.
Yep, exactly. We're going to get you a little freer here so we can exit. So we can go straight down that hallway, okay? Really use your arms because what happens with that nerve block today and
watch those little wet spots like that.
Yes.
To the double joints in the brain. Oh, no. Pieces of
I
heart.
just want to see if I can walk without the walker.
sir.
Hopefully you can keep that for years so you can stay active. And I think you've hurt your kidneys. So when you leave, I'm not sending you out with any oral Toradol, okay?
Man, that's the
But
only
you need
thing
to-
that's helping me.
I know, but at the same time, you want to go on dialysis. Dialysis is scary, isn't it? So I'll give you some Celebrex, you can get some Tylenol, but you really need to talk to your family doctor about working up your kidneys when you get out of here, okay?
Good.
How do you improve?
You don't, you just minimize the damage.
By no I know that Advil, of course, like kills people's kidneys up.
Yeah, so it's avoiding those medicines that damage the kidneys.
I've been in so much pain the last 24 hours.
I know it's been hard. It is hard. But we gotta also think about long term, right? If you lose your kidney function, for your creatinine to go up, you've got to lose 60 to 70% of your kidney function. Okay, you only have 2 of them, and they don't regenerate. So you don't want to.
No.
What did you say the normal creatinine is?
For his age group, it should be around 1 or less.
1 or less.
Yeah, on his pre-op labs it was 1.6. Yesterday it was 1.5. Let's see, where's that basket?
What about, does the tramadol hurt me?
It doesn't hurt your kidneys, no.
Okay.
So, but we've got to be really careful about that. I have to get you a new knee immobilizer. And we gave you your first dose of Xarelto last night, so it doesn't help with your bleeding. We did a lot of work in there, so I'm not surprised you're getting some oozing. It may ooze for a few days.
So that's normal right now to see that. Okay.
And then again, we started his Xarelto. You can see he's swollen under the skin right here.
Yeah.
Yeah. And then I gave you 10 milligrams of Xarelto yesterday, but today we're going to go up to 20, which is your home dose. So that's going to actually make you ooze a little bit more. So I don't like tape on the skin. Okay, I think tape actually damages the skin. So you notice I haven't been taping any dressings on you.
Yeah.
I've been
Wrapping it.
wrapping it. So try to do that as much as you can rather than tape. All right. Some nurses are going to be really tempted to try to put a pressure dressing on your knee, but there's no way they can stop the oozing from inside with the pressure dressing. So you don't want them to put it on so tight that it compromises your skin.
Okay.
Okay. I'll have one of the PAs bring a new knee immobilizer up here because this one's soaked.
So what about this? I mean, he needs to get these supplies, which is more wraps and more pads, right?
So most of these you can find at any pharmacy.
Okay, yeah.
But they usually will send you home with a few if you remind them to. The Velcro 6-inch aces are hard to find, but there are other types. The ABDs you can find at the CVS and stuff.
We found a guy
or Amazon.
A local guy, medical supply store. But yeah, Amazon would be cheaper.
Yeah, the
Buy in
supply
bulk.
stores charge significant extra.
So what would this be redressed every day?
So because he's oozing, I would say every time he soaks through.
Every time it soaks. So just kind of open this and see, and if it's soaked through.
Yeah. Normally I let you shower on Thursday, which would be tomorrow.
Yeah.
But the wound needs to be dry before you can shower. I don't want him showering if it's oozing, okay?
Okay.
And in the shower, just as long as you don't bend your knee. So sit in the chair, get in the shower with the brace on, and then sit down on a shower chair, stick your leg out, have your back to the spray, okay? Stick your...
You got a little handheld.
Yeah, but have your back to the spray, okay? And then it can hit your back, and it can actually come down over top of your knee as long as the wound's dry before you get in the shower, so no oozing. I don't mind if soap and water come down over top of it.
But as long as it's not oozing before you get in.
Yeah. If it's oozing, it means that it's not sealed, so what comes out, if it goes out, it can come in.
Yeah.
Okay, that's the only issue. If it's not oozing, the wound is sealed. Now, if you're in bed in a controlled environment, you can open the brace up and just let it sit like that to get air.
Okay.
Okay? It's only when you're moving around
That you need the brace on. Okay.
that you need the brace. Now, this surgery hurts. It does. Never told you it wouldn't hurt, did I?
No.
And there are lots of different ways to deal with pain. And, you know, pharmaceuticals is one way, but you had committed to not doing it pharmaceutically.
Well, not opiates and narcotics.
But we also have to remember that we don't want to damage the rest of your body.
Right.
And so anything we give you, any medicine, has side effects. You agree?
Yeah.
Opioids have mental side effects and addiction side effects. But anti-inflammatories have kidney side effects and heart side effects.
Right.
Okay?
So can I take Advil, Tramadol?
So
and-
Advil
It's anti-inflammatory.
Advil is probably what caused your creatinine to go up.
I mean Tylenol.
So Tylenol is fine as long as there's no alcohol in your system.
No, I don't drink.
And then Tramadol, and it will get better. I assure you it will get better. Ice also helps, okay? You can put ice on top of this, 20 minutes on, 20 minutes off, okay?
Right, so Celebrex, Tramadol, and Tylenol.
Right, and the Celebrex is an anti-inflammatory too that hits your kidneys. So I'm going to give you some, but again, don't take it unless it's absolutely necessary.
I should just take the Tramadol.
Hi, good evening. It's Steve Kendall from the Save from Opioid Foundation. For those of you who've been following my story, I had a total knee replacement on Monday. It was a little more than a total knee replacement. I had a completely torn quadricep. Hey Danny, I had a completely torn quadricep and I had a broken kneecap. So it was a more intensive surgery than a normal knee replacement. But I did this opioid free. As you know, I'm the president of FightOpiates.us, and we're getting ready to file a class action suit for individuals against the opioid manufacturers and distributors. So I wanted to prove to everyone that this could be done opioid free with simple nerve blocks and alternative medicine. I was put on Toradol, Tylenol, and Celebrex. And granted, you know, I had a lot of pain yesterday when the nerve blocks, when the nerve block wore off. But, you know, I got used to it, and the more I thought about it, the pain I had before my knee surgery was almost as bad as what I experienced yesterday. But today is the third day, and I feel really good. I have to stay in a straight brace for the next 30 days because of the extensive repair on my quadricep. But this meant more to me than just a knee replacement. This was for me to prove to everyone that you can have a major surgery without, hey Sylvia, how are you dear? I wanted to prove to everybody you could have a major surgery without taking opioids. Hey Mike Timms, what's happening buddy? Just went through major knee surgery, reconstructive quad surgery. They fixed my kneecap, all without opioids or narcotics.